The resurgence of cholera outbreak in parts of the country has raised concerns to people. As it is now, 15 states and the Federal Capital Territory have reported more than 1,700 cases with over 15 deaths recorded so far. Now, just today, Wednesday, 10 new cases of cholera were reported in 4 area councils of the Federal Capital Territory, with a fear of figures even rising continually. Now, what exactly is cholera and what are its causes? Is it a communicable disease? Well, answers to these questions shortly, as with me in the studio are experts in the area whom together we'll be having conversation around this very topic today. My name is Musba Wahab. Welcome to Nigeria Today. You meet them in just a moment. Thanks a lot for staying tuned in to Nigeria Today on NTA News 24. The topic is on your screen right there, cholera outbreak in Nigeria. And joining me in the studio to talk about this topic is Dr. Ewart Ndayo. He is the Acting Executive Secretary of City Primary Healthcare Board. You're very welcome, Doctor.
Thank you, my brother. God bless all of us.
Also joining us in the studio is Dr. Basi Okposen, Director, Disease Control and Immunization, National Primary Healthcare Development Agency. So nice to have you, Dr. Okposen.
Thank you. Good evening, Nigerians.
Very good evening indeed. Now, to a layman, now I don't know if I am one of them or where I'm standing. How will you describe cholera? What is exactly cholera? Let me start with Dr. Ndayo.
Thank you, my brother. I think it's good that we put it out there and for community members, residents across the country, particularly FCT, to appreciate that the definition should be made very simple so that anybody out there should understand that you are looking at microorganisms that are causing severe acute diarrhea disease with rapid dehydration, loss of water, fluids, and probably electrolytes, and that will lead to sudden death or can lead to death in a very short time. You note those words that I've chosen. I've chosen a word like severe. That is something very critical and, dangerous. I've chosen something like acute. Acute is sudden, something that happens suddenly and is affecting you and is causing harm. Then I've chosen diarrhea. That means there is watery stool at least 3 times a day, and you see immediately it is established in a matter of some few hours after you have contracted the microorganisms. The passage of watery stool is so rapid and frequent, and is at times you describe that stool as being rice water stool. That is a kind of water that you get when you are washing your rice after boiling rice. Then I've used something like fast and rapid dehydration. That is where you lose a lot of water, and the water content of your body are depreciated in such a way that it can compromise life. So at times it's also accompanied with vomiting. So when you have all this together, and you begin to put cholera at the front of your desk to be excluded, because it is a common cause of this kind of problem.
Thank you very much, Dr. Ndayo. Now, you have established the connection between cholera and diarrhea and all of that. Now, Dr. Okposen, a lot of people actually know about cholera, but what can you say are the major causes of this disease?
Okay. Cholera.
Yeah.
I will link it from the beginning, starting from where Dr. Ewart has stopped, and then the causes of it, as you've asked. It is an acute diarrhea disease that affects the intestines.
Okay.
And is caused by a bacteria called the Vibrio cholerae of the serotype 01 and 0139. Now, the major sources that will cause it: one, the feces of somebody who is infected with this cholera when the person passes through, and this too contaminates water or food. And somebody who is hitherto healthy drinks this contaminated water or food, that person can come down with cholera. So it is caused majorly by the contamination of water or food by the feces of somebody who has been affected with the Vibrio cholera. And there are environments that will increase the risk. One, majorly areas where you have inadequate and poor water supply, dirty water, as we are now during rainy season. If the person that is infected defecates, like we see open defecation in many areas, rain comes, washes that into a nearby stream or a well that is not surrounded, of course, and then the people living around it drink that contaminated water, they can come down with cholera. Now, this same water can be used to cook food, and the food is not properly cooked, or that person is eating fruit and this fruit was not washed with the clean water, with disinfected water. Such an individual can also come down with it. Again, there are people that live around the riverside coastal region. The shellfish, for instance, can also harbor this Vibrio cholera. And if it is not properly cooked, that person can come down with it. So it is advised individuals should practice basic hygiene. They should stop open defecation. They should boil their water before they drink. And of course, keep the environment clean at all times. Ensure that if you want to eat food, that food is properly cooked with clean water. You wash your hands frequently, especially if you are in an area where there are cases of cholera, and even at all instances with the COVID-19 and other diseases, frequent hand washing will also help. So we advise Nigerians, please practice good sanitation around your home. Try to get clean water to eat or to drink. If you are fetching water from well or stream, those water should be properly boiled. If you are an individual that can purchase things like chlorine or iodine, there are ways that these are used to treat the water. You'll be advised by your experts. But let's avoid drinking water that are not clean and eating food that is not properly taken care of.
Yeah.
So these are the commoner ways and people can come down with cholera.
Wow, real. Basic sanitation and hygiene are the basic words here coming out from your submission, Dr. Opose. Now, it seems that we're having connection with other diseases such as polio, Ebola, and even Lassa fever. It's all about basic hygiene. Dr. Ndayo.
Yeah, sure. Absolutely. Cholera and diarrhea diseases and the diseases of environment, environmental sanitation, very important that we should note. That is why you see when your environment is optimal in terms of sanitation, you stay off a lot of diseases. So many of the diseases that we are having in our society, in our communities, are preventable and they are from the environment. Malaria, for instance, you know what that means. We don't need to go far here where you have to take care of your environment. So let's come back to cholera. And it is the good news is that it is treatable and it is over 90%, and I would say 99% preventable. And it is a disease of filth, the fecal-oral transmission that Dr. Bassi has pointed out. That is where the contaminated fecal matter. So where you have the environment that is having open defecation, we are having Ministry of Environment and the Department of Environmental Health across the local governments and probably the FCT area councils, working on open defecation and then Rural Water and Sanitation Agency, that is RWANSA, that has just been established in FCT, that is concerned about triggering open defecation free in the FCT, and that agency is just new. And I want to tell you that I can say that no community in FCT has been triggered, that have been demonstrated to be open defecation free. And the implication is that excrement, human excreta, littering the surface of our compounds and farms and everywhere. And with these early rains, you see these things being washed into streams, and you agree with me that potable water supply in FCT is not also optimal, and we are having issues with that. But then we are doing something, that we are looking at domestic immediate interventions, that you are identifying communities that will have issues of water supply.
All right, Dr. Ndayo, we're going to get to the point where you tell us about those measures you have started.
Okay,
we are fully aware of the campaign against open defecation that the federal government has been championing, and of course state governments as well as other stakeholders are also joining in the campaign. Now, Dr. Oposen, what statistics do you have from your agency in Nigeria today? How many states would you say have recorded cholera? We know we have a lot of them, including the FCT that just recorded 10 today. What about the figures from your agency?
Okay, I think it would be good we start from the global statistics and narrow down to the country.
Right.
Globally, every year we record about 2.9 million cases, and then out of this about 95,000 persons die from cholera every year. From Nigeria contributes greatly to this also. For this year so far, we've had cases from 17 states. It's starting from one, it's picking up to another. Currently, the states we are having that are active are Bauchi, Plateau, Kano, and Niger. Then the FCT now, the recent ones. The one in Kano is also beginning to retreat as the cough day is going down. And the Bauchi has been doing a lot also to bring down their cough. So we're seeing it active in Plateau and FCT that is also coming up currently. So those are the states we've had it for now. Ironically,
the states with the highest number of people practicing open defecation in Nigeria, that's Kwara State, is not part of these states recording the outbreak of cholera. That's an irony for me. Now, let's quickly take a break. We'll now look at how to combat this disease head-on. Thanks a lot for staying tuned in. Is Nigeria Today on NTA News 24, and we have been having conversation around cholera outbreak in Nigeria, and with me two experts, Dr. Iwat Ndayo and of course Dr. Basi Oposen, talking about this disease and how we can solve the problem in Nigeria. Dr. Ndayo, you talked about FCT not having any single area council that is open defecation free yet. Now, the FCT is supposed to be a champion, a kind of model for other states to follow, being the seat of power in Nigeria. Now, how do you begin this fight against cholera right from now?
Thank you so much. Let me, you made a note before we went on break.
Yeah.
About Kwara State and other stuff. Yeah, you have to match the triad. there's a cycle that you have open defecation. Yes, Kwara may not be practicing open defecation. It's just that by statistics that they have more people doing that. But
Of course.
do you know the level of potable water supply in that area? So is the residents having contact with contaminated sources? That is where the problem comes. So you may be practicing open defecation, but you don't have contact with those things, then you may not likely have that. So for FCT, just as I said earlier, that the triggering of community certification of communities as being open defecation free is not the indicator that people are not having open defecation there. But there got to be certain things we have to put in place, and the community participation aspect that will be very clear. So those things are what we are beginning to do now. You see, because just as I said, the RWANSA, the Rural Water Supply and Sanitation Agency, FCT, has just been put in place now by the Minister of State, FCT, and they are working on that. And in fact, this problem has come at a time that they are right on the field. So I was trying to tell you about the supply of potable water now to those communities, and having to get their sanitation right. So we are not just looking at this situation the way people out there are thinking. We have got to be very orderly. We have got to be strategic. Otherwise, we are going to lose more lives, and we are going to have this thing.
So what are the
even more.
strategies?
So what we have done, let us start from the strategic leadership, where the minister and the Minister of State had to engage all the 6 area councils chairmen in a town hall meeting at the level of the FCT, and then the Secretary to Health, Dr. M.B. Kao, and the Director of Public Health. We have swung into action, having our emergency operations center with an incident manager and the 7 pillars to take care of the response in the FCT. And we have also considered a team. If you can see me dressed up like this, it's not long we came back from Abaji. We sensitized the chairman in council, the traditional leaders. This is direct interactions with the people that can move resources to ensure that this is done. And at this level, we engage the water board. As we have said, it's a water-related issue. And the RWANSA, as I've said, the director, they are coming in place now. And we are showing people the domestic treatment of water, how to filter their water, to use the elements that Dr. Bassi also mentioned, the chlorination of water, and usage of alum for local water treatment, and boiling and filtration. So these are things that we are going, and these are immediate actions that we are taking now. And the communities that we are having this stuff, we have over 400 in FCT and about 26 deaths, which is very sad. These are preventable deaths, and it is unacceptable. And as we took decision today that this should not happen in FCT, it shouldn't be escalated in FCT, the curve must come down, because we are out there now, and we are doing the needful. So the NCDC has given us the window to not only do the rapid diagnostic test that has been, the kits have been shared to all the secondary health facilities in FCT. The clinicians have been sensitized, and we have also brought in the primary care centers, 112 of them in the FCT. We are also culturing this too, because you may have cholera, but there are other bacteria that can cause decent diarrhea diseases. You have things like Klebsiella and Shigella and even E. coli. These are bacteria of excreta. They are also there. So we have got to do culture, we have got to do sensitivity, and we have got to type the cholera that we are having in FCT. What type are we having? You heard of the various types of the organisms that can cause disease. So we are doing all that. And I want to assure you that what we are doing here now is very important to me. That is why I had to be here, because this will serve as a sensitization too. So people that are listening to us will be better informed, and they will know that they have over 90% of chances of preventing this disease.
Right.
And the disease is preventable. So they should not just sit down there, report any case of diarrhea and vomiting, or even diarrhea alone, to the nearest facility. Everybody is vigilant now and is on active surveillance.
Now, indeed, it is preventable, and of course, it seems you have started to do a lot about controlling this disease, and we hope to see the results very soon, and a number of people contracting it. Now, Dr. Oposen, as of March this year, Nigeria Center for Disease Control said it has started monitoring the situation and coordinating the national response so far. What are the findings? And particularly now, we want to know what are the roles that health ministries or from federal and states are supposed to be playing at this point in time?
Okay, from the national, what we're doing currently, we support the investigation of these cases at the state level. The agency, NPHCDA, under the leadership of Dr. Faisal, and then the NCDC, Dr. Chikwe. The staff from both agencies are supporting the states in investigation. You know, if someone comes down with cholera, we need to take this tool for sample or the rectal swab for the culture, as Dr. Ewart mentioned. So we are on that, and the HCDC is leading the investigative part of it. And also, in some of the early cases of cholera we had, from the agency and PhD, we had some donations of the vaccine, which was used to support the vaccination in some of the states that had cholera early this year, like Benue and Kogi. And currently, we have also applied to ICG for additional vaccine to be able to respond to the cases we are having now. And then with the support we are having from the government so far, we have also applied to Gavi. Cote d'Ivoire is the only country so far that have access to have received vaccine this year to start the routine. We also want to support the control in country with the vaccination, and we have very high support from the leadership, from the presidency to the minister, and the effort from the executive director, Dr. Faisal. We are now knowing that they can be able to give vaccines to African countries and for the little countries that is available to start vaccination. We also want to be one of the early countries to have this vaccine to use routinely for our adults in the risk areas for those aged 18 to 64 years. So these are some of the efforts that are ongoing. But permit me to use this opportunity to also inform Nigerians that it is good we know the early signs of this cholera, because early intervention saves life. Cholera, once somebody contacts the bacteria, it has on an average 2 to 3 days for the person to come down, but it can also be from a few hours to up to 5 days at the range. There are some people that immediately they contact, within hours, they start showing signs. Most of the cases are asymptomatic. Out of every 10 cases, 1 will turn severe. And when we say turn severe, what are the signs that will show that this particular person is cholera? Number 1 will be watery diarrhea. Stooling will be watery, more than 3 to 5 times in a day for somebody who was defecating normal. And then this same person will also have vomiting, and on top of this will also be cramps on the legs. So when these 3 signs are combined, you will see immediately this person can come down with dehydration. It is the dehydration that will cause shock that the person can die. So it's good Nigerians know this on time, so that once they see such signs, one of the earliest things that needs to be done is to rehydrate the person. Immediately start with the first aid of ORS, the oral rehydration therapy that we also give to children. It can be helpful in some instances, and when that person is taken to a clinic, if the dehydration is much and the person cannot tolerate oral, the clinicians, they will now give drips to rehydrate the person. It is the dehydration that kills much. But once the person is also at the facility, now the opportunity of giving an antibiotic, because the bacterial infection now limits the effects that we will see in most of the cases of cholera. So it is good if it is detected early, the person is taken to a facility, primary healthcare facility or any health facility near. There could be interventions that will save life early, because if ignored, the dehydration kills in a moment or in hours. So it's good Nigerians know and take action. And above all, we advise Nigerians, please, we have the cholera cases around now. Wash your fruits before you eat them. The water you drink, be careful. Don't eat or drink open waters like that without knowing the source of it and knowing that it has been properly boiled and is fit for drinking. And then cook your food well. Avoid raw foods,
Right.
and especially chefs and the rest. And this will keep us safe as a nation.
All right, thank you very much, Dr. Opose. Now, basic sanitation and hygiene are the key answers to this scourge of cholera in Nigeria, and we hope to see people saved and lives saved from this, and we don't want any more. We've lost some lives to Lassa fever, Ebola, and of course the coronavirus that we still have at hand. On this note, we like to say a very big thank you to our guest in the studio, Dr. Ewart Ndeyo, the Acting Executive Secretary, FCT Primary Healthcare Board. We really appreciate your time.
I appreciate you too.
And
Thank
Dr.
you.
Basi Opose, Director, Disease Control and Immunization, National Primary Healthcare Development Agency. Thank you very much for coming.
Thank you.
All right, you can always be part of Nigeria Today on NTA News 24, weekdays, Monday to Fridays, and you can watch this edition and other ones on youtube.com/NTA News 24 Hub. I am Musbadan Wahab. Stay safe.